When I was in kindergarten, my friend Eva shared with me and a few of our other friends that she was diagnosed with leukemia. Now, at the time, we didn't know what that even was or how that could affect her. During this presentation, I will discuss what exactly the leukemia disease is and how it is treated. You can help people diagnosed with leukemia by listening to this presentation and becoming more informed, and by possibly donating your blood to save a life. So what exactly is leukemia? According to Yale Medicine, leukemia occurs when, quote, abnormal cells build up in the bone marrow and prevent normal cells from developing, end quote. There are many different types of leukemia, but acute lymphocytic leukemia is the most common amongst children, according to the Children's Hospital of Philadelphia. ALL, or acute lymphocytic leukemia, makes up around 30% of all pediatric cancers. Now, when the blood cells develop in the bone marrow, they need one, space to develop new cells and kill off old unhealthy cells. And what leukemia is doing is filling up this bone marrow with so many white blood cells that there is no space to have healthy and normal development. So since leukemia is such a diverse disease, it needs a variety of different testings to diagnose. To start, your doctor will order a full blood count, or FBC, to see if there are any abnormal numbers of the blood cells. If your results come back and show abnormal numbers, another test will be done. This test will be a bone marrow biopsy to look into your bone marrow and see any abnormalities. Once that is done, a diagnosis will usually be complete and a few other non-routine tests will be run. Once you get your diagnosis, there are different treatment plans that you can choose from. Now, as a child, you wouldn't be able to choose that until you're 16 in California in the United States, but as an adult, you would be able to choose if you would like to go through with active treatment, which has the end goal of getting rid of the cancer completely, or you could choose on going with supportive care, which focuses on maintaining symptoms and giving the patient as much comfortability as possible. Now that I have explained exactly what leukemia is, I will go over the many ways it is treated. According to the MD Anderson Cancer Center, the most common way to actively treat leukemia is through a combination of chemotherapy drugs and radiation therapy. Now, chemotherapy and radiation can be quite harmful since it goes in and zaps and kills the cells. It has the possibility of killing other new healthy cells. For example, your hair, it might kill your hair cells, causing hair loss, or it could damage your skin cells, causing rashes. It could damage your immune cells, causing you to become more sick. So, that is one way to treat leukemia. Another way to treat leukemia is by using a new method called gene therapy. According to Scott Gottlieb, MD, who is a commissioner for the FDA, he says, quote, "We're entering a new frontier in medical innovation with the ability to reprogram a patient's own cells to attack a deadly cancer," end quote. So basically what gene therapy is doing is removing these cells, training them to be able to fight cancer cells, and then putting these cells back in your body when they're modified, and hopefully those cells should go and rid the cancer completely. Now, this is a new procedure, so it is not very common yet, and it is quite expensive, so it is not always available to low-income people. So, one way by helping people with leukemia is, 1, becoming more informed. When you hear leukemia, you should know what it's doing to the body, not just that it's a cancer. And you should know exactly how diverse this cancer can be and how diverse the treatments can be. Another way you can help is by donating to your local blood bank. And this can be really helpful because once someone has their cancer cells killed in the body, they will need to replenish their blood, and that is most often done through blood transfusions, which comes through blood donors. So, just to help you get a better visualization, this is normal blood in the body. As you can see, these are the red blood cells and the white blood cells. These purplish ones right here, there's only 3 of them. In the leukemia blood, you have many white blood cells and less red blood cells. So the white blood cells are taking up so much space that there's no room for the other blood cells to grow properly. Here's another example. You have normal red blood cells, platelets, and here's leukemia, where you have leukemia cells rapidly growing and developing inside the blood and taking up more space. So hopefully you understand what it is, how it's treated, and exactly how you can help. Thanks for watching.